Hello, I'm Dr. Brandt Gibson, and I would like to talk to you about a proprietary system, a process that I've created to help you manage your peripheral neuropathy. It's called the Gibson Method. Now, over the last nearly 20 years, I've been working with peripheral neuropathy patients, trying to figure out exactly how to give you not just treatments, but a solution if possible. Now, as much as I would love to say I've found a cure for peripheral neuropathy, I have not, but I have found that through this process, through the Gibson Method, we can actually give you the tools that you need to manage and control and ultimately live with your peripheral neuropathy without it interfering with your life. Most of the time, people with peripheral neuropathy will find three things. They find that it will distract them from the things they're trying to do, that the discomfort, the pain will be there. They find that they have discomfort. A lot of times it will wake them up at night and keep them from being able to sleep. And they may even get disability associated with it. So with the distraction, the discomfort, and the disability, a lot of times you're not living the life that you want with peripheral neuropathy. For that reason, we created the Gibson Method. And so what I want to do is tell you a little bit about the Gibson Method as part of our discussion here online. And the Gibson Method has two distinct pieces. When I'm able to see a patient, when they're able to come to me and see me in my office, then we use the Gibson Method through a series of 4 visits to help them, one, understand peripheral neuropathy, what it is, and understand their individual peripheral neuropathy. What are the characteristics of their distinct peripheral neuropathy? So that they can say, okay, now that I know what the characteristics are, and now that I have a diagnosis of what's causing my peripheral neuropathy, I can work on the other pieces. So then they can say, okay, now I'm going to start managing my symptoms. So I have these particular symptoms that we help them lay out, and they go through a process of managing those symptoms. And they go through a process of controlling the disease processes that are causing it. That's why the Gibson Method is designed to help them get the diagnosis. Do they have a compression neuropathy? Do they have diabetic neuropathy? Do they have a vitamin deficiency or a vitamin dependency neuropathy? Do they have a toxic neuropathy? Are there medications they're taking that's causing this problem? And by doing that, they can actually create a process or a plan to control the damage. So they start by managing the symptoms, and they control the damage so it doesn't get worse. And then they say, okay, from there, now that I'm controlling the damage, now that I'm managing the symptoms and I'm helping the nerves to heal, I can live without the distraction, without the discomfort, and without the disability. So that's kind of that individual process there. So through 4 visits, we can give them a full picture of what their neuropathy is so they can work through the process and through the different treatment options to control it. That's part of the Gibson Method. And the Gibson Method really is a diagnostic tool to help them and help their doctor, in that case it would be me, determine the causes of their peripheral neuropathy and the correct treatment options to manage the symptoms, to control the nerve damage so that they can thrive and live an extraordinary life. Now, this other part is for all those individuals anywhere in the world that are not able to come into my office, that are saying, I don't live close enough. I can't make that trip. And so what are they going to do? So what we did is we created a 90-day boot camp, a process that will take you through the exact same steps. So it will take you through understanding what peripheral neuropathy is. And through a daily process, you can learn what peripheral neuropathy is and your individual peripheral neuropathy. From there, then we'll give you some of the tools and some of the information so you can start to manage the symptoms and start to reduce the discomfort and disability and distraction that are coming from those symptoms. And then from there, we actually can take you to the point where we say, okay, what are the causes of my peripheral neuropathy? What is causing my nerve damage so that you can actually control that nerve damage? And then from there, so you've got those 3 pieces in place, then you say, okay, now what is my process that I can live, my neuropathy lifestyle, that I can live for the rest of my life managing the symptoms, controlling the injury of the nerves so I can thrive and truly live an extraordinary life. So the Gibson Method has both pieces. But the whole point of the Gibson method is to give the power back to you. We're taking the power away from peripheral neuropathy. We're taking the unknown of the diagnosis of peripheral neuropathy from you and giving it back the power to say, okay, you truly can understand your peripheral neuropathy, understand what it means, what's causing it, how to treat it. And then we'll give you back the power to say, okay, I'm going to take these symptoms that are interfering with my life, that are causing disability, distraction, and discomfort, and manage them such that the distraction goes away. The discomfort is not waking you up at night. In fact, you don't even notice it. It's not keeping you from doing the things you want to do. And then the disability is gone. You can now go play with your grandkids, your children. You can now go for hikes and walks. You can now play racquetball if that's what you want to do, or go running if that's what you want to do, and not have neuropathy keep you from doing those things. And then from there, you can get the control. Say, okay, I'm doing great right now, but peripheral neuropathy is progressive. It continues to get worse over time. So I'm going to take back that control and control the nerve damage by eating right, by using the right treatments, by taking the right vitamins, by living the way I'm supposed to live, so that continual damage to the nerves doesn't happen. And I can always keep and manage that control of that nerve disease, that nerve damage that's happening, so that I am in complete control, or you are in complete control of your nerve damage, of your peripheral neuropathy. Because the truth is, you deserve to live an extraordinary life. You deserve to not have anything that's going to interfere with you living that extraordinary life that you were born to live. So that's the reason I created the Gibson Method. So for the next several days, we're going to be talking about the things that you can do to manage those symptoms. And part of that is going to require, in the long run, that you go through the Gibson Method to get a true diagnosis of what's causing your peripheral neuropathy, what's causing your symptoms. Why do you have discomfort? Why do you have disability? Why are you being distracted by this nerve problem? So that you can actually find a way to manage those symptoms and ultimately get back your life. This is Dr. Brandt Gibson. And as you can tell, this is one of those subjects that gets me really, really, really excited, because I'm giving you back the power over your peripheral neuropathy. No longer do you have to say, I have peripheral neuropathy and there's nothing I can do about it, because that's not true. So this is Neuropathy Nugget, day number 10, and we're just starting. Over the next several days, we're going to give you some tools so you can actually manage those symptoms and you can start getting your life back. And then from there, we're going to give you some tools so you can control the nerve damage. And ultimately, we're going to give you all the tools that you need so you can live an extraordinary life, even with peripheral neuropathy. In fact, we're going to help you so it will never interfere with your life from then on. Who knows what you can do if you don't have the interference? This is Dr. Brandt Gibson.